What is CAMHS? CAMHS stands for Child and Adolescent Mental Health Services and is a service that supports young people through the assessment and treatment of emotional, behavioural and mental health needs. We want CAMHS to be a safe place where we work together with young people, their families and our team to understand what is happening and find the best ways to support them through adolescence. Wandsworth CAMHS is based in the Trinity Building at Springfield University Hospital in Tooting Bec and is part of the South West London and St George's Mental Health Trust. Tooting is one of London's most diverse areas and is within Wandsworth, which was awarded the Borough of Culture Award in 2025. At Springfield Hospital, we are committed to equality, diversity and inclusion for all young people. And Wandsworth CAMHS is committed to anti-racism and to ensuring everyone referred to our teams can access support and engage in treatment. We recognise that discussing sensitive topics can be difficult and that some communities have historically faced barriers to accessing mental health services. We encourage our clients to share anything they feel is important with their health professional or care team to help us support them better. For example, translation services, issues faced by the LGBTQ+ community, cultural factors, or needing to adapt therapy materials. We are committed to providing a safe, inclusive space where young people can talk openly and to working together to understand the experiences and difficulties that have brought them to us. But if you feel unable to speak to your health professional for any reason, our website has contact details for further support. We continually work to make our services more accessible, inclusive and responsive. We also recognise the importance of individual differences and considering each person's wider family or system. The services that make up Wandsworth CAMHS are Tier 3 CAMHS, the treatment team for moderate to severe mental illnesses, Single Point of Access, which is the triage and assessment team and often described as the front door for all CAMHS referrals, the Under 5s team, which works with children aged 5 and under and their families, the Youth Justice Service team for young people needing CAMHS assessments related to contact with youth justice services, the Pupil Referral Unit team, which works with young people attending pupil referral units, Children and Social Care, which is an embedded team working to support young people who may be known to social services or are looked after children, mental health support teams, which are school-based support teams, and our admin and support staff who progress referrals and who are a valued part of the team. Across our Wandsworth CAMHS teams, we offer a range of different evidence-based interventions, including group, individual and systemic. We will consider with you whether our contact should be in person or virtual, and we will review these with you as you go and may ask you to fill in screening questionnaires along the way. We are eager to make sure that your views, wishes and experiences are taken into account whilst we work with you and your family. So who might you meet in CAMHS? When you come to Wandsworth CAMHS, you will meet a range of highly trained professionals and clinicians who work with children, young people and their families experiencing mental health difficulties. Our Wandsworth CAMHS services include clinical, counselling and assistant psychologists, child and adolescent psychiatrists, family and systemic psychotherapists, doctors, clinical nurse specialists, and some of our fantastic trainees in all these fields. CAMHS inpatient services have mental health nurses, psychiatrists, psychologists and family therapists, dietitians, and allied health professionals such as occupational and art therapists. CAMHS can work with many difficulties, including depression and anxiety, eating disorders, PTSD, and can also address serious mental health problems such as bipolar disorder and psychosis. So how do you get to CAMHS? Most CAMHS services require a referral from a doctor, school, or another professional, though some local services allow you to refer yourself if you're over a certain age. If your referral is accepted, you will be placed on the waitlist for an individual assessment and signposted to other support while you wait. Mental health services are in high demand and waiting times can be long, but the team does their best to reach you as soon as possible. At the top of the waiting list, your referral is examined by Single Point of Access, which screens referrals for those aged 5 to 18 presenting with difficulties with emotional well-being and mental health, and referrals for neurodevelopmental conditions such as autism or ADHD. After a triage call or assessment with you and your family, gathering information such as family history or completing psychological assessments, you will be signposted to the most appropriate services for further support or intervention, with more information available on our website. If needed, longer mental health screening assessments can be arranged, usually 90-minute appointments in person, by video or by phone. If you are accepted into the service, a treatment plan will be developed with you, your family and the team. Then the intervention can begin. CAMHS offers various interventions for treating common mental health needs, such as CBT, DBT, family and systemic psychotherapy, interpersonal therapy, trauma-focused CBT, EMDR, and generally working to reduce self-harm and support young people to stay safe and well. To deliver interventions in a way that meets each young person's needs, CAMHS uses frameworks to help clinicians understand the whole person. The Social Graces framework outlines key aspects of identity and helps practitioners consider both their clients' identities and their own, and how these influence their work. Intersectionality highlights how overlapping identities shape experiences, and together these give a fuller understanding of a person's life. But what happens if you turn 18 while under CAMHS? CAMHS works with those aged 5 to 18 years, but for young people needing support beyond age 18, transition workers help guide them to the most appropriate adult services. The care team will refer them to adult mental health services for a first appointment, and they will decide if their service is right for them. Our team are doing their best to get to you as soon as possible, but while you wait, you will be offered welfare check-in calls to stay in contact and update us on any changes in your circumstances. You can also let us know if you no longer want CAMHS input or if there are key people we should speak to. CAMHS will speak with your school and other professionals involved in supporting you, such as social workers or key workers. While you wait, our website offers resources for supporting young people and their families both before appointments and between sessions. Here are some strategies, including getting good sleep and some helpful resources and contacts. You can share your views on CAMHS and how we can best support young people by CAMHS Public and Patient Involvement Group. To find out more, please visit our website or get in contact with us. We know that coming to CAMHS might seem scary, but it can be really helpful, and you could even come to enjoy it.